I'd like to thank Mayor Jane Castle of the City of Tampa, members of the media, as well as community leaders, public safety and public health experts for joining us today to address a global issue that has the potential to affect our entire community. The coronavirus, also known as COVID-19. First of all, let me make it perfectly clear. There have been no reported cases of this illness in Hillsborough County, 0 cases. But that does not mean that we can become complacent in the face of what could become a very serious threat to our community. Hillsborough County Office of Emergency Management, alongside the City of Tampa's public safety leaders, are fully prepared to respond to any scenario that has the potential to cause disruption in our communities. Hillsborough County and the City of Tampa officials are in constant communications with the Florida Department of Health and our public safety leadership while we monitor global and national events associated with the potential spread of this virus. As I said, at this point, there are no confirmed cases of coronavirus in our region or in the state of Florida. However, we will continue to diligently monitor the global and national situation until this threat has passed and respond appropriately if the need rises. We are in cold and flu season. Be ever mindful of that. We all know how to avoid those illnesses, and this coronavirus is no different. Wash your hands often, use sanitizer, stay away from people that are sick, and if you're sick, stay home. Let me repeat that. We all know how to handle the flu and colds, and this coronavirus is no different. Wash your hands often. Use hand sanitizer. Stay away from people that are sick, and if you're sick, please stay home. Lastly, the last information about this and any potential emergency situation in Hillsborough County, I encourage you to visit our Stay Safe page on Hillsborough County website. The address is hcflgov.net/stay safe. That page has all the information you will need on this issue, as well as other issues such as hurricane preparedness and other planning tips. I also encourage everyone to sign up for the HCFL Alert, the county's official mass notification system. It is designed to keep you informed about emergency events in the county with instant text, voice, or email messages on any device. I want to thank everyone for being here. Now I want to turn it over to Mayor Castor.
Thank you, Commissioner Miller. And thank you to Hillsborough County and to the members of the media that play such a critical part in getting the message out to our citizens and keeping all of our residents informed. I want to begin by asking everyone to take out their phones and text Tampa Ready to 888-777. Tampa Ready 888-777. This will provide real-time text containing information on this topic and many other emergency situations for all of our residents. As we closely monitor this tragic coronavirus outbreak around the world, we must take the approach of not if, but when. And that's why we're standing here unified to protect our very diverse and ever-growing community here in Hillsborough County. We will certainly take and are taking steps to keep this virus out of the Tampa Bay area. However, we must all be prepared to deal with it. We, the city, county, and state, have been in close communication concerning the identification of and response to any cases that may arise. We're also taking steps to keep our residents informed via text messages mentioned earlier and a variety of other means. We're asking all residents to do everything that they can to prevent infection and the spread of it as well. Basic steps, as mentioned by Commissioner Miller, washing your hands, keeping your hands away from you, using hand sanitizer, staying away from individuals who are sick, and if you feel symptoms, ensuring that you get medical attention immediately. Tampa Fire Rescue, alongside Hillsborough County and our emergency management team, have plans in place to respond to communicable disease threats, but each type presents unique challenges. We will remain flexible and adjust our plan as necessary and as we receive guidelines from the CDC and government health agencies. Let me reiterate as well, in case someone didn't hear it the first time, there are no cases in the Tampa Bay area at this time. But this situation is constantly evolving. We're here together with our partners to ensure our residents we are as prepared as possible to deal with this disease if and when it arrives in our community. From the city side, our EMS personnel will be extra diligent in looking for symptoms of respiratory illnesses, and they have the ability to take the temperature of patients who may present symptoms. For years, we've worked together to plan and train our systems for disasters ranging from hurricanes to infectious diseases. We've hosted countless major national events here, and each year as we conduct annual medical surge exercises to test our hospitals and medical system response capabilities. Our collaborative approach to these incidents makes us stronger and more resilient when it comes to responding to any incidents. As in this case, with many things, they are and will continue to be a lot of rumors going around, and it's vitally important that all residents get their news from a reliable source. Visit tampagov.net/alerttampa or cdc.gov or the Department of Health website at floridahealth.gov to get the most current updates on the coronavirus or any other diseases. And again, please text Tampa Ready to 888-777. And our thoughts go out to all of those individuals who have been affected by this virus around the world. Now, we have Dr. Lockwood from USF School of Medicine, and we also have the emergency managers from Hillsborough County and the City of Tampa if there are any specific questions that you would like to ask.
Mayor, given the current landscape in Hillsborough County and in Tampa, you haven't had any cases even in the state of Florida. Is your concern right now primarily health or the possible economic impacts that we can feel here in Tampa?
Right. Well, both those we have to be cognizant of both of those situations. You know, the economic impact is something that we're all going to feel. If you look at the particular masks that are worn to avoid the transfer of this virus, those are made in China. And so there's going to be a lot of economic impacts, big and small, but clearly the health of our residents is something that we are laser focused on.
The governor of California just said there are several thousand people who are at least monitoring for coronavirus. So the question that I have for you is, he used the word inevitable in saying that they were going to see numbers like that in California. Do you consider it inevitable that we will see those kinds of numbers in Tampa and Hillsborough County?
No, I don't see that as being inevitable. The majority of our flights that come into the Tampa Bay area are domestic. So again, we will do everything that we can to prevent, which is what we always do. But on the other hand, we will be prepared to respond to any issues that arise. And we will also keep our residents informed minute by minute.
Will residents of Hillsborough County and visitors to the county notice any differences in their day-to-day lives as
they're not going to notice any differences, but that doesn't mean that we don't have monitoring in place in locations where individuals will come in to our city and our county, like the airport and the port and bus stations, those types of places, that there will be monitoring done in those locations.
Is that happening right now, like monitoring?
Yes.
Are you planning to provide any supplies to those communities that doesn't have access to the precaution that they need, like hand sanitizer, like a mask. Are you planning to provide those for us?
We don't intend to provide, we'll provide supplies to anyone who needs those, but we don't have any plans to pass out masks or hand sanitizer at this point. If it comes to that point, then every community will be able to get whatever supplies are needed. All right, thank you guys very much, I appreciate it. Thanks, sir.
I've been doing it all day long.
So we should have like a separate hand in the sign.
Yeah, yeah, like they do it on the ships.
Yeah.
You know, you can't.
I think this, if it ever comes to the state of Florida, those areas that get the worst.
Thank you.
Questions? Charles Lockwood, Dean of the Morsani College of Medicine. I think it's worth reiterating a couple points. One is that there are 327 million Americans, and there may be one case in California where this was community acquired. So it is, at this point, not a public health concern. It's a public health concern, but it's not a public health crisis. The second point is that even if, in the worst case scenario, it's very unlikely that Hillsborough County or Florida would see a major problem in many months. And certainly the worst case projections would suggest peak activity, if it occurred, would occur in August. So we have a long time to prepare. And I do think that the best advice was given by Commissioner Miller, and it's to wash your hands, stay away from sick folks, keep environmental surfaces clean, and there is at this point no recommendation from the CDC for using masks, if that was a question, and they're unlikely to be all that effective at this point. But you know, again, there have been no cases reported in the state, and there may be one case of community-acquired coronavirus in the nation.
Do you mind expounding on what would make Florida, more susceptible or less susceptible to having the virus affected?
Well, the big risk, I suppose, is tourism, is people coming into the state. And on the other hand, there are a few things that we know about this virus. 80% of folks that have it are either asymptomatic or have very mild infection. 15% are affected more severely, and they tend to be older folks. Because of the nature of the virus and the way it binds to the respiratory tract, children are actually at very low risk. So I noted that Japan had closed down their school system. Probably that may not have been necessary, but it's good to be young. It's always good to be young. It's bad to be old, and so the risk of infection climbs when you're over 60. I'm paying attention to that a lot. And if you have multiple other medical problems, particularly heart disease. But if you're under 60 and you're healthy, the risk is much, much, much lower. And if you're a child, it's even lower still. The only thing that we know that are protective at this point are things you don't want to do, like smoking. Smoking turns out to be protective. It's very bad to do, and I won't be recommending that. But the best way to avoid the infection, if you're in an area where it has become epidemic, is exactly what the commissioner said. And at this point, again, the CDC does not recommend face masks.
What indicators, what scenarios would have to play out before you would urge public officials here to limit public events, to tell the convention center to not?
Well, we'd have to see cases of community-acquired infection, and
Can you just explain what that means?
so right now the 14 cases that have been documented in the United States have all been travel-related. There's a case in Sacramento that's being evaluated that could have been acquired in a way that we can't determine. It wasn't from someone that traveled from China. It wasn't a healthcare provider that took care of a patient with coronavirus. So that would be a community-acquired case. And if we start to get cases like that, in Florida, then I think the level of concern would rise, and there are a number of things we can do to, again, mitigate the risks of transmission. Some of the things include trying to avoid having large numbers of people aggregating together, particularly indoors. So, but we're not even near the point of those recommendations being implemented.
So what symptoms if someone's not feeling well and they have a cold and they're nervous that they have coronavirus? What are
Well, yeah, if they have a cold now in Florida, it is not coronavirus, so make that very clear. Secondly, the influenza virus killed 80,000 people in the United States last year. That's a much bigger concern, and yet people still don't get vaccinated. So explain that to me. So number one, if you haven't had your flu vaccine, have it. That's critically important. And the symptoms of coronavirus, again, in a large number of patients, may not be anything. You may be asymptomatic. For those that do manifest evidence of the infection, fever, cough, a sore throat, and breathlessness. It turns out that the best predictor of the disease is a low level of oxygen in your blood, what we call PO2. And so if you're short of breath and you're in an environment where you know people are getting infected, you should see your doctor right away, and you should call your doctor in that event and warn them that you're concerned about this so that they will take steps so that you don't infect other patients in the waiting room.
What's the challenge with something like this? Obviously, it's something new. You don't have a vaccine.
Yeah.
From a medical standpoint, what are the biggest challenges with something?
That's a great question. So we really don't know where this fits in the scheme of pathology. Coronaviruses are, first of all, fairly common. 25% of colds are caused by coronavirus. This is not that kind of coronavirus. The two previous significant pandemics or epidemics were MERS and SARS, and both were much more severe than this, had much higher case fatality rates, but they were also much harder to get infected. So the current estimate of infectability of this virus, what we call R0, as of this morning, was 2.8, which is a lot higher than the flu and a lot higher than MERS or SARS. But although the infection rate's higher, that may actually be in some ways a good sign because it suggests that a lot of patients are getting infected. And again, a lot of them may be asymptomatic. And again, the virus tends to be attracted, if you will, to the upper respiratory tract. That's very good. That means you have more cold-like symptoms and not the lower respiratory tract, which would be very bad, and that would be more consistent with pneumonia. So at this point, it does seem to be a little bit more infective, if that's a word, infectious than the flu, but much less concerning from a fatality standpoint than the other two prior coronavirus epidemics.
Any other questions?
Oh.
What plans do you have available for the schools at this point right now?
Sure. Well, yesterday we've been in constant communication with the Department of Health. They've been a great partner here for our school district, making sure that our folks are speaking daily. Yesterday we sent out some preventative tips. Much of those were in Mayor Castor's and Chair Miller's remarks as well, to ensure that they are aware of things that they need to do. Washing hands, the prime thing to make sure that we do. But we are ensuring in our school sites, we're taking a look at the physical structures. So we are looking at providing hand sanitizers on all buses, entry points into our schools, so that helps those particular areas. Extra cleaning in very sensitive areas of the campus. We're looking at some vendors who can come in and really sanitize our campus as well during this process. All the things that we need to do to communicate on a regular basis as we get updates, we'll be doing for our families, making sure all our protocols are in place in our school clinics to get information quickly from medical professionals, stockpiling supplies and so forth for those purposes as well. We also have to consider if it does get down the road, any issues, how we create some continuity of learning for students who may have to stay home, whether it's for the flu or anything. We do that already on our campuses, but to make sure that we have remote access to learning, we post our assignments on Edsby, which is a communication tool for our parents to make sure that the students can keep up with their work at home. Those are just natural things we do anyway, but it will be extra vigilant here.
Do any kind of education with students who might be hearing about this on the news and TVs here?
Sure, our communications team is already putting together some videos that we will put out to our schools that will help educate our students, our families, and our employees as well.
Okay, thank you all for coming. Appreciate it very much.